The Home Secretary said today the way police treat black people with mental health problems has to change. Theresa May was speaking at a conference on mental health in Westminster. A Home Office review found black people were twice as likely to be referred into mental health care through the police than average. Our senior correspondent Ron K. Phillips reports from the conference.
Sheni Lewis, Sean Rigg, Roger Sylvester and Ibrahim Shea. Black men who all had mental health problems, but were treated like criminals instead of patients and died while being restrained. The Home Secretary told delegates the way mentally distressed black people are treated generally has to change.
Research shows that people from black African and Caribbean communities are more likely to be referred to mental health services via the police and criminal justice system, with admission rates 2 to 4 times the national average. African Caribbean people are also more likely to be treated under a section of the Mental Health Act, and evidence from the London Assembly suggests that not only are up to 30% of people who are tasered by the Metropolitan Police emotionally or mentally distressed, but 50% of those tasered are from black or ethnic minority backgrounds.
Sheni Lewis died in 2010 after he collapsed during a prolonged restraint by police. His family claim he was held down 3 times, first by hospital staff and then by officers for over 45 minutes.
Why police should be called into a mental hospital to restrain a patient is a question I ask myself every day. In a hospital, you expect hospital staff, not riot police.
Musician Sean Rigg died in 2008, shortly after these shots of him being restrained were taken. Earlier this month, his family were told 2 officers involved in his arrest will not face criminal charges. They and other families whose loved ones have died say it's time someone was held accountable.
Even if there's just one initial accountability that's made now, it will send a clear message to both the families that justice has been served, and also a clear message to police officers.
Theresa May announced a series of measures designed to improve the way mentally ill people are dealt with by the police and a review into the use of taser guns. Today marked a breakthrough for the families behind the headlines. They welcomed the rhetoric. What they want to see now is action and those responsible for the deaths of their loved ones held to account. Ron K. Phillips, ITV News.
I'm joined now by Matilda McCatron from the organisation Black Mental Health UK. Thank you so much for coming in. What do you think about the Home Secretary's announcement today?
For us, it's definitely progress. We haven't seen any government department take on board the concerns we've been campaigning about for over 8 years this seriously. So we see this as a marker and a very good starting point to addressing perennial concerns that touch the lives of every single black family living in the UK.
Why do you think the numbers are so disproportionate, though?
That has been an ongoing concern, and there's no data to show there's high rates of morbidity. So people from the UK's African Caribbean communities aren't madder than anybody else, but they're more likely to be subject to detention. So our concern is the coercion, the way the act is used against a group. So there are many reasons why, and it has been debated. Some people say that perceptions of certain groups and perceived danger or maybe pathologising cultural norms might be one of the reasons. But what we're really, really pleased about today is that the Home Secretary has acknowledged the fact that there is a disproportionality and she's very keen and committed to seeing that being addressed.
Well, I mean, what would you say to the Police Federation? Because they've said that the Home Secretary's reforms just add more bureaucracy.
They don't add bureaucracy, because what she wants to see is appropriate services deal with people who need healthcare. What she's committed to seeing is the inappropriate use of police forces, both in the community and in mental health settings, being addressed. And so the Federation have a point, but from our perspective, it's not accurate.
OK, well, Matilda, thank you so much for joining us.
You're welcome.